Hi, I'm Dr. S.Prashanth, hand and microvascular surgeon at Panortho Hospital. What is trigger finger? See, trigger finger is the inflammation of the tendons. The fingers have got long tendons which are responsible for movement of these fingers. See, these are the finger, these are the tendons. These tendons have got certain pulleys. Pulleys means they are going to restrain those tendons so that will increase your grip strength. That is increase the more strength of the finger is depend upon the action of the pulley. There are three pulleys out there. See, one is here, and another one is three or four pulleys are there in the fingers. So whenever there is an inflammation, swelling of the fingers, for example, here there is a swelling, you can test. These are the point where these trigger finger can happen. One is in the thumb, common. Next is the index finger. Next is the middle, and fourth and fifth finger. This is the point we look for triggering of the finger. What is going to happen is that whenever there is an inflammation, swelling of the tendon, that pulley will become thickened. That's why the finger will be unable to glide easily. It will just struck like this in between, or we may have to make it straight like that. There will be a lot of pain. These are the few common symptoms that we come across in case of trigger finger. Next, the question comes is what are the causes, how it is going to happen. Still today there is no perfect one cause for that. It is called as unknown reason, but still it is quite common in say diabetic individuals, inflammatory conditions, rheumatoid arthritis, Goutia arthritis. These are the things quite commonly associated with the trigger finger. Now the question comes, how do you diagnose the trigger finger? Diagnosis of trigger finger is mostly clinical. Patient typically comes with pain and unable to bend the finger, unable to straighten it. Then we can able to diagnose clinically. Plus, you can go for an ultrasound examination, which will also very well demonstrate the thickened pulley and the inflamed tendon. Then, what is the treatment? Treatment is most of the time it is non-operative treatment, where we can give some anti-inflammatory medications for about a week. And we can use some physiotherapy, ultrasonic stimulation to the finger, which will reduce certain inflammation. Or you can go for stretching of your fingers. If you stretch these fingers just like this, that will release your triggering effect to some extent. This we can try as a non-operative methods. Suppose if still affects, if it still not get relieved, then we can give a local corticosteroid injections to those points. These are the knots we can palpate, you can see, and put the injection exactly there. That will reduce the inflammation. Very important thing is while putting a local corticosteroid injection is we should never try to infiltrate in the tendon substance. That is going to weaken the tendon. Always try to put it over the thickened ligament, which is going to ease, which is going to reduce your swelling. When surgery is indicated, very few cases, if it is not responding to say anti-inflammatory medications, stretching exercises, even steroid injections, then we may have to do a small surgery in which we are going to open here and relieve that mechanical blockage. So then the triggering will be gone. So this will require a later physiotherapy as well for few days, which will help in gliding of the tendon, increase your grip strength. Thank you.